Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Eisenberger, the Medical Officer of Health at the Middlesex-London Health Unit, and the Executive Vice President and Interim Chief Clinical Officer and Chief Nursing Officer at London Health Sciences Centre, Carol Young-Ritchie. Happy to be joined by members of the media this afternoon as well. And in case you are joining us for the first time today, to ask a question towards the end of the briefing, just click on the text bubble with the question mark in it here on Microsoft Teams. And if you could indicate your name as well as your media outlet and who your question is for. Finally, welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching us on the CTV London website. Let's get to the opening remarks, and we'll start this afternoon with Mayor Ed Eisenberger. Mayor Eisenberger.
Well, thanks, Dan, and good afternoon, everyone. You know, it's always great to start a new work week with just 2 new cases in London, Middlesex. You know, that's our lowest daily case count since early August. And across Ontario, we're seeing similar signs of progress with consistently lower case counts week over week, and down even further when you compare it to the same time last year. All good news. And these are things we should remember and take comfort in, especially when faced with the kind of anti-vax nonsense we saw in Victoria Park over the weekend. As I've said before, despite their best efforts, groups and individuals like this, well, they're losing public support each passing day. The numbers don't lie. The numbers show we're nearing 90% vaccination coverage in London. Support for truth and support for science is on the rise, while support for ignorant messaging to the contrary is on the decline. Most of these people who showed up in Victoria Park over the weekend aren't even from London. Instead, they pulled like-minded knuckle draggers from across Ontario in hopes of misrepresenting the breadth of their support. You know, it's not lost on me as well that a member of City Council not only attended but spoke at this event on Saturday. Unfortunately, I'm not surprised, but I am horribly disappointed. He's openly and visibly defying and undermining council policy by virtue of his participation. As such, it wouldn't surprise me in the least if complaints are filed with the Integrity Commissioner regarding those actions. Council, as most know, does not have the ability to sanction a fellow councillor. Those decisions are at the sole discretion of our Integrity Commissioner. As mentioned, I wouldn't be surprised if a complaint is lodged as a result of what transpired. But ultimately, as I mentioned off the top, our focus must remain on continuing the positive momentum we've seen across the board with declining case counts, lower hospitalizations, and fewer deaths. All positive news for the greater good. And we're achieving this because Londoners in overwhelming numbers are kind, they're compassionate, and responsible. And I just want to say thanks to them. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. As always, appreciate your comments and support. So we had a truly tremendous weekend in terms of case counts. We continue to see the 7-day moving average decline, and we had our lowest case count yesterday, just 2 cases since the very beginning of August before the 4th wave kicked in. I'll just Dan, briefly share screen here so we can look at the chart together. So this is the case counts as well as the 7-day moving average, which is available at the healthunit.com website. And you can see here yesterday, just 2 cases reported. We haven't had a number that low since August 2nd when we had a 0-day. And so really, this is the lowest we've been in through the whole 4th wave. And I bring it up not because of the single day count, but because of the long-term trend. You can see the downward trend here. Our cases are really getting lower. And again, that 7-day moving average of about 10.3 cases per day is the lowest we've had since August as well. It was end of August when we saw those sorts of numbers. So this is not the end of the 4th wave, but it's currently on the decline, which is incredibly positive and something we absolutely need to be celebrating. Other than that, there isn't a lot to speak about. The vaccine campaign continues on with mobile clinics trickling in. We do have the 2 mass sites open, the Agriplex and Mount Bridges, but We haven't yet got permission to vaccinate the elderly with their third doses, or the children 5 to 11 with their first series of 2 shots. We hope to be able to announce that someday soon, but we don't have details there yet. And happy to say that we haven't had any deaths over the weekend. Things are good at the moment, all because of the things like vaccination rates and mask mandates staying in place. It's just very clear from around the world. I get this question all the time: when are we going to have? When can we take the masks off? But in places around the world, even highly vaccinated places where that's happened, you've seen additional waves of COVID, and in some cases, those waves have overwhelmed the healthcare system and caused many deaths. So it's not time yet to remove the masks. It is time to make sure everybody gets fully vaxxed, and looking very much forward to vaccinating the children. Happy to pass to Carol Young-Ritchie from LHSC for more comment.
Great. Thank you, Dr. Mackie, and good afternoon, everyone. Thank you for having me here today again to speak about the COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 10 COVID-19 positive inpatients, with 5 or fewer of those patients being in critical care. In our children's hospital, we are caring for 5 or fewer COVID-19 patients, with again 5 or fewer of those being in our pediatric critical care unit. On the vaccine front, our staff and physician numbers continue to improve. As of last Friday, nearly 97% of our staff and over 99% of our physicians and residents have submitted proof of being fully vaccinated. Our mandatory vaccine policy comes into effect this Friday. As per the language of the policy, staff and physicians have until then to provide their proof of vaccination. No disciplinary action has been taken in advance. We will proactively communicate any resultant information and details after such time. We continue to encourage everyone in our community to continue to follow the public health guidance, even as reopening continues to expand in our community-based events and activities. Please wear a mask, physical distance, practice hand hygiene, and book an appointment to get your vaccine at your first convenience if you haven't already done so. Thank you.
Thank you, Carol. Thank you, Dr. Mackie, and thank you, Mayor Holder. All right, we do have a lot of questions, and a quick reminder again, if you are joining us for the first time as a member of the media, just click on the question mark inside the text bubble here on Microsoft Teams to submit your question, indicating your name, your media outlet, and who your question is for. Let's go to the questions that have already come in. The first one, Dr. Mackie, is for you. It comes from Jane Sims at the London Free Press. Dr. Mackie, the MLHU has posted that the outbreak at Ryerson Public School has resolved. Can you update us what happened after the outbreak was declared and how many secondary infections were discovered?
Yeah, thanks for the question, Jane. There was just the one case that was uncovered. Many additional children were tested and none turned out positive. So, as I said when we first described the situation, it definitely a situation to learn from. Again, one teacher exposed to many students over relatively short periods of time. But of course, we did take all the precautions in the schools to make sure those classes got tested. And to see, other than that one first case of possible transmission, to see no other cases is very encouraging. It speaks to the vaccine's effect on reducing further transmissions. We know that the research shows that the vaccine, although it doesn't completely prevent acquiring COVID and transmitting to others, it reduces transmission by about 60%. So that's actually quite good if you look at something like, the influenza vaccine or others. And so the vaccine did substantially reduce the likelihood of this person transmitting, and that's why we saw only one secondary case. Very encouraging. A huge thanks to all of the teachers, students, staff, families, parents who were involved in that case, and especially to the teacher, who we haven't named, but of course the classes would know. That person being double vaccinated prevented, possibly dozens of secondary cases.
Thank you very much. Let's go to a follow-up question from Jane Sims for you again, Dr. Mackie. Have there been many tickets handed out to recreational facilities since the letter of instruction was sent out? Have there been any outbreaks linked to sports tournaments?
Yeah, thanks for the question, Jane. We've had lots of outbreaks linked to sports tournaments across different parts of Ontario. We haven't had any here lately, so that's encouraging. Also very encouraging that the sports organizers very much, for the most part, saw this coming and were able to implement it. We haven't had any tickets. We've had a few concerns come up. We've been able to address those with the individuals in question, and we haven't really seen significant organized opposition from any particular place on this.
Dr. Mackie, and I know there's one more question from Jane, and that is also for you, and it actually comes, I think, probably a day early, but we'll go here nonetheless. Dr. Mackie, can we get an update on the vaccination uptake? Have we reached a point where everyone who wants to get vaccinated has been vaccinated? Do we still have a shot at 90% full coverage in Middlesex-London?
Yeah, thanks for the question, Jane. I know this is moving, we are moving towards 90%. It's moving more slowly probably than many of us would like to see. I don't think we have reached the point where everyone who is going to be vaccinated has been vaccinated. Certainly everyone who wants to, but we know that some people are making the decision to get vaccinated because of the vaccine mandates that are in place. And of course, we support and encourage and facilitate that. I think we're going to get to 90%. I think the Christmas season with children getting vaccinated will get some of their parents who haven't had the shot yet. I think as we go into third doses for the elderly, we'll pick up a few extra folks there. We know that, the percentage uptake of first doses is very high in that population, but second dose is a bit behind, so that will help us come up as well. And then so once we've gone through those two big groups, we're going to keep going with the mobile clinics and reaching those who need it. We're as much as possible trying to expand the range of places that our mobile clinics go. We had the Middlesex-London paramedic service, the ambulance service that serves London and Middlesex, doing a lot of workplace campaigns. They've had some staffing changes and have had to kind of reassign. So we're re-looking at how do we handle workplaces, can we get into workplaces more with the resources we have in order to try and bring the rate up in the 18 to sort of 39 age group, which has been the lowest so far. But absolutely, we're keeping our eyes focused on 90%, and I believe we're going to get there, Jane.
The next question is from Andrew Graham at Global News Radio, 980 CFPL. And this is for Dr. Mackie or Mayor Holder, so I'll watch for which of you would like to take this first. Andrew asks, what have you been hearing from local businesses in regards to enforcing Ontario's vaccine certification program and potential resistance from customers? Mayor Holder.
Well, thanks, Andrew. In fact, I'm hearing not the potential resistance from customers, but the encouragement from customers. And here's why. Customers want that kind of certificate program enforcement to protect themselves, to protect their families, to get as close to back to normal as they can. This push is market driven. So you know what that means? That means if customers want it, business responds. And it's that kind of direction that I think certainly business owners recognize, but also the greatest majority of customers recognize it's the right thing to do. Let's go back to the numbers. Close to 90% of Londoners have been vaxxed. Pay attention to that number, almost 90%. And you get the fitful few who imagine the rules don't apply to them, and guess what? They can't play. They may not be able to go into bars and restaurants. They may not be able to travel. They may not be able to go into public facilities and watch their kids play hockey. And you know what? I really want to care for them, but you know who I want to care for more? Are the people that take this seriously and understand that this is about broader public health and to protect their kids even when they're not prepared to.
Dr. Mackie.
Yeah, not much to add. I mean, we really haven't seen a lot of complaints. I think people learned from those early experiences, the complaints when the individual was at the restaurant in downtown London, and the follow-up was quick, and that restaurant changed their tune right away. Others, I'm sure, are watching that and saying, this is not worth the hassle. But the mayor's point as well, like, this is something that, our country uniquely around the world is taking this vaccine up like almost nowhere else. Our country is showing a belief in science, a belief in medicine, a belief in caring for each other and doing something that's going to protect, self and also protect community. And I think I'm very proud of London, of Ontario, and of Canada for taking that up.
Andrew has a follow-up question again for both Mayor Holder and Dr. Mackie, and it does relate to the demonstration that happened in Victoria Park on Saturday. Dr. Mackie and Mayor Holder, with regard to the anti-vaccine mandate rally that was held in Victoria Park Saturday, did local businesses or Londoners voice any concerns as a result? Mayor Holder.
Well, thanks very much. Sure, there were some concerns initially that some of these folks from the protest would go in and negatively impact their business by showing up, putting pressure on their staff to enter a facility, a restaurant, or a bar, as one of them did the last time. And so there was, I think, to be fair, there were some that were nervous that might happen again, because you know what it does? I really do want to say, I want to forget the knuckle draggers. I truly do. What I want to pay attention to are the businesses that are impacted by this. I think the health unit showed really thoughtful discretion when this happened as a complete surprise. And I'd say the first time the restaurant that was impacted was overwhelmed by it. And I thank the health unit for its discretion. But in truth, these businesses are equally concerned of the potential, the reputational risk by letting people without masks in. Don't forget, 90%, we're getting close, have had their shots. So to allow others in, that not only is a reputational risk and a financial fine, but it's about doing the right thing, and they want to protect their customers. So there was a concern that might happen. It didn't. Everything I've been told is that these folks, because they had to go back home, and it was a long way for a lot of them. So I would say that they put up their protest and left, and so be it. But it was more about businesses wanting to do the right thing, and fortunately, it was much ado about not very much.
Yeah, I mean, the only thing I would add is that I was incredibly encouraged to hear the businesses who were aware of this rally being planned, were aware that similar rallies have, turned violent in some places in Ontario in recent days. And as a downtown business, the health unit received a note from downtown London saying, look, this is happening. You may want to consider closing your business. And what I heard from business owners is, no damn way we are closing down. We are not going to be afraid. This is a minority. Our people are strong. Our people are beside us. And we are not running away. We are the ones in the right, and we're going to stay, and we're going to run our businesses. And this is background noise that doesn't matter to us. And that sort of solidarity, we're standing together against the people that are making dangerous and foolish decisions, is what's gotten us to this place in the pandemic, and it's what will get us through to the end of it.
Thank you very much, Dr. Mackie and Mayor Holder, for those responses. Let's go to the next question. It's from Jacqueline LaBelle at Global News Radio, 980 CFPL, and Carol Young-Ritchie. This one is for you. LHSC's vaccine policy for staff requires everyone to have completed both doses and the 14-day waiting period no later than October 22nd, which would require that staff receive their second dose by the 8th of October. And I think I heard you say the percentages at the start during your opening remarks, but come Friday, how many staff members will be in violation of the policy? Oh, Carol, I think you're on mute.
Should know that by now. Thank you. Again, I'm really proud to say that 97% of our staff are fully vaccinated and 99% of our physicians. As the days go on, that number continues to go up. So our final day for implementation of our policy is this Friday. And I will say that we are committed to being transparent with that information, sharing that information, and that information will be shared on Friday.
Thank you very much. Next question. Sophia Rodriguez from CBC London for Dr. Mackie. In the last 2 weeks, the number of fully vaccinated people who have gotten COVID make up about 48% of total cases. What can you tell us about that? How concerned are you about breakthrough cases?
Yeah, really important question. Thank you for that, Sophia. So we knew this would happen where, we're at the point where almost everyone is vaccinated, or, well over 80% are 2-dose vaccinated now. So it's not a surprise that we're seeing, as many cases in that group as in the unvaccinated group, because there are just so many more people who are vaccinated. So of course you're going to see relatively higher number. So what it really boils down to is that the rate in people who are vaccinated is far, far lower. It's about 10 to 20% of the rate in people who are unvaccinated in our community or partially vaccinated. In other words, we're seeing in the real world the same sort of data that you saw in the clinical trials where 80 to 90% of cases are prevented by the vaccine. It's just there are so many more people vaccinated now than unvaccinated. You see those absolute numbers come up. So not a surprise. It is one that takes some, understanding where the numbers come from to get one's head around why those numbers seem similar. But again, the rate in people who are unvaccinated is, about 8 times higher than people who are vaccinated right now, which is right where we kind of expect it to be.
Thank you, Dr. Mackie. Follow-up question from Sophia at CBC London. This one is for Carol Young-Ritchie. Carol, is LHSC expecting to receive any COVID patients from Saskatchewan or other provinces who are overwhelmed with the amount of patients they have?
So no, not at this time. Any provincial transfers are coordinated through our provincial critical care command table. And what the command table does for the province is look across the province to see where there's availability to move those patients. Because there's a high proportion of patients west of Hamilton and between Hamilton and Windsor, the Ontario West area is not taking any patients from Saskatchewan, and they will be dispersed across the rest of the province.
Thank you very much. Let's go now to our next question. It's from Andrew Graham at Global News Radio 980 CFPL. Mayor Holder, this one is for you. Andrew says, I am unsure of the legality of it, but do you plan on filing a complaint with the Integrity Commissioner against the councillor you referred to? If not, are there any other avenues you plan on taking? Sorry, Mr. Mayor, I think your microphone is muted.
Well, I already gave the answer. I don't have to do it twice. Andrew, I indicated in my comments earlier that council does not have the ability to sanction a fellow councillor. That's at the sole discretion of the Integrity Commissioner. You were very specific in your question. I will give you a specific answer. While the legality of the process in terms of outcomes is a function of the Integrity Commissioner and what they can or choose to recommend, if anything. The question is, can anyone file a complaint? The answer is yes. Will I file a complaint? The answer is yes.
Thank you very much, Mayor Holder. Let's go to our next question. This is for Carol Young-Ritchie from Jacqueline LaBelle at Global News Radio. When can we expect more information about the vaccine policy for visitors to LHSC?
Yeah, thanks for that question. We're just putting the final touches on our visitor policy and looking to implement that beginning of November. So I'm hoping that's going to be out to the public. Again, we just want to make sure we have that right and anticipate that'll be coming out this week.
We've got a follow-up question for you also from Jacqueline. LHSC's vaccine, actually, we already answered that question. So I'm going to move on to the next question. And actually, that takes care of our questions. There was another one, but it was answered by one of the previous questions. So, all right, that does bring us to the end of our questions for this afternoon's virtual media briefing. There's a bit of a flurry at the end there, so I appreciate you hanging on with us. Just want to remind folks who are looking to get vaccinated that the mass vaccination clinics are open this week. The Western Fair District Agriplex is open for vaccinations today until 6 p.m. and its regular hours of operation are from Thursday through Monday from 11 a.m. to 6 p.m. And then on Tuesday and Wednesday, vaccine is available at the Caradoc Community Center in Mount Bridges. You can check out the hours at healthunit.com. That does bring us to the end of today's virtual media briefing. We thank you for your attendance. We will be back with our next virtual media briefing on Thursday, the 21st of October, and we hope you'll join us then. So between now and Thursday afternoon, have a great rest of your Monday. We'll see you on Thursday, and so long for now.